Hello, everyone. My name is Robert. I'm a student of Nightingale College. The reason why I'm here, I'm going to be performing a video skill for you, which is the administration of oral medication. First things first, I am not in the patient's room yet. I'm just at my staging area. For my supplies, I do have hand sanitizer here. I have gloves, and I also have the oral medication, and I have a paper towel and the patient's water. So first thing I'm going to do is I am wearing my ID band, by the way. I have my school uniform on. So the first thing I'm going to do is I'm going to wash my hands since I'm at the facility. First thing you always do is wash your hands. Now I'm going to go and verify the physician's orders with the electronic health records. With the electronic health records and the physician's orders, I'm confirming the 6 rights, which is going to be the right patient, the right medication, the right dosage, the right route, the right time, and the right documentation. Those are the 6 rights. Everything looks good there. I'm going to be doing those checks at least 3 times, starting with once I get the medication out. Now I'm going to verify the medication against the electronic health records. And what I'm checking for is the right medication, of course, and the right patient with the 6 rights, as I mentioned. Today, I'm going to be administering Dococet sodium, which is going to be 100 milligrams of Dococet sodium. I'm going to be administering warfarin, which is 5 milligrams of the warfarin. I will also be administering furosemide. It's going to be 20 milligrams of the furosemide. I'm going to be administering potassium chloride, which is 20 megs of the potassium chloride. And the liquid medication is going to be the acetaminophen, which is going to be 500 milligrams of the acetaminophen poured into a 15 ml dosage amount. The trade name for each of these medications, for the Dococet sodium is Colace. For the warfarin, it is Coumadin. For the furosemide, it's Lasix. And for the potassium chloride, it is Kador. And for the acetaminophen, the trade name for that one is Tylenol, in case you need that information. So now that I confirmed that the 6 rights are good with the medication, as I said, I'm going to verify the 6 rights at least 3 times. That was the first time checking the medication against the electronic health records. Now I can go in and meet my patient. I'm going to introduce myself to the patient and also tell him why I'm there. So I'm not going to, let me gather my things, go knock on the door. Hello, Mr. Jones. Hi, my name is Robert. I'm a nursing student from Nightingale College. The reason why I'm here is that there's a doctor's order for you to receive oral medication at this time at 9 a.m. in the morning. So before I begin, let me go ahead and put my items down. I'll go ahead and provide you some privacy. Shh. And now I'm going to go and wash my hands, right? So I wash my hands, right? Wash my hands. And now that my hands are clean, I'm able to touch the patient. So reason why I want to touch the patient at this moment, Mr. Jones, can I please see your ID band? Can you please verify by verbalizing your full name and your birthday? I'll have the patient verbalize his name and birthday. It's Raymond Jones, March 10th, 1975 is his birthday. Thank you, Mr. Jones. Before we begin, I'll ask the patient, do you have any allergies to any foods? Any allergies to any medications? Any seasonal allergies? Patient said no. So now that I already checked his ID, I'm going to go ahead and check against the electronic health records, making sure that everything looks good with the medication, his name, electronic health records, and all 3 are good. That is my second verification. So from there, I'll go ahead and explain to Mr. Jones the medication he's going to be receiving. The first med that Mr. Jones is going to receive is going to be the Dococet sodium. That's going to be 100 milligrams of the Dococet sodium. I would explain to Mr. Jones the mechanism of action for this medication is that this medication is basically a stool softener. The way it works is that it will promote the incorporation of water into the stool, into your fecal matter to kind of soften it up, making sure that you don't have any dry, hard bowel movements, because that can be dangerous for certain patients, especially if a patient has a heart condition. Not saying that he does or anything, but that is what that medication is for. It's a stool softener. I would explain to Mr. Jones that there are some contraindications for this medication, meaning that we would not give this medication. If he has a history of hypersensitivity, we will not give this medication. If Mr. Jones has abdominal pain, nausea, or anything like that, we would not give this medication. I will also explain to Mr. Jones the adverse reactions and the effects and the side effects. For this medication, it is diarrhea. Mr. Jones could have a rash after this medication. Also abdominal cramping. I will explain to Mr. Jones that if he has any of these signs and symptoms, for whether from the adverse reactions or side effects or from the contraindication, we'll make sure that he let us know that so we can stop the medication and communicate with the doctor and go from there. Right? Yeah, so as far as stopping, that would be up to the doctor, but at least if he lets us know, we'll be able to let the doctor know and let the doctor decide what route to take, right? So I would also explain to Mr. Jones that the next medication that he's going to be taking is warfarin. He's going to be receiving 5 milligrams of warfarin. I would explain to Mr. Jones that the mechanism of action for this meds is to prevent blood clots, right? So for this medication, there are side effects to this medication as well. I would explain to Mr. Jones that this medication could cause hypotension. So because of that reason, I will want to check his blood pressure before I even administer this medication. I would also advise Mr. Jones to use a soft toothbrush when he's brushing his teeth. I would also advise Mr. Jones to minimize using a razor because he could bleed easy. So we wouldn't want him to cut himself. One of the side effects also is hematuria, meaning that he could have blood in his urine, or he could even bruise easy. So a contraindication of this medication, if Mr. Jones has a GI ulcer, we would not give this medication. If Mr. Jones has liver or kidney disease, we would not give this medication. I'll give Mr. Jones a chance to ask questions about that medication. No questions? Okay. So the next medication, potassium chloride, I would explain to Mr. Jones that he's going to be receiving 20 megs of potassium chloride. Mr. Jones, this medication is basically used as a supplement to make sure that your potassium levels does not drop too low, because there's certain medications like certain diuretics would actually drain the potassium out of your body. So this medication is more of a supplement to make sure that your levels stay healthy. For this medication, I would definitely want to check the patient's labs first to make sure that his potassium levels are not too low. The side effects of this medication is vomiting, nausea, and upset stomach. I will remind Mr. Jones to let us know if he's having any of those side effects or symptoms or anything like that. Also, this medication does have a contraindication. If the patient has hyperkalemia, meaning that if his potassium levels are already too high, we will not give this medication. If the patient has kidney disease, we would not give this medication. I would give Mr. Jones a chance to ask questions about this medication. No questions about this medication? No? Just a reminder, please let us know if you experience any of these side effects or signs and symptoms from the contraindications. Okay? The next medication I would explain to Mr. Jones is going to be furosemide. This is Lasix. I would explain to Mr. Jones that he's going to receive 20 milligrams of this furosemide. This medication is used for the treatment of hypertension. I would also explain that this medication is also used for edema due to heart failure and renal disease. So that's the reason why the doctors will prescribe this medication. I would explain to Mr. Jones that this medication can cause orthostatic hypotension. And because it may cause orthostatic hypotension, I would advise Mr. Jones to be very careful when he's getting up out of bed, to move very slow because it could cause him to be dizzy. We don't want that to happen. Another side effect, another side effect of this medication is hyponatremia. And also, although there's orthostatic hypotension, also just hypotension by itself, just a low blood pressure. So I would advise Mr. Jones to make sure that he communicates if he's having any of the side effects of this medication. This medication does have contraindications. Contraindication is like if he has a history of hypersensitivity to this medication, if he's not urinating, if he's having like anuria, definitely we would not give this medication. If Mr. Jones has a hepatic coma, we would not give this medication. So I would give Mr. Jones a chance to also ask questions about this medication. But beforehand, I want to definitely check Mr. Jones' blood pressure and his heart rate. Because if it causes hypotension, we want to make sure this blood pressure is not already too low, right? So the last but not least, the last medication that we will be advising and communicating to Mr. Jones about is going to be the liquid medication. And that is the acetaminophen. Mr. Jones, you're going to receive 500 milligram into a dosage cup of 15 mLs, right? So it's going to be 15 mLs of this medication, which is going to add up to 500 milligrams. The acetaminophen, also Tylenol, is usually prescribed. I would explain to Mr. Jones that it's usually prescribed for fever and minor pains, right? There are side effects of this medication, which is it could increase liver disease. The liver enzymes is a side effect. It could increase Mr. Jones's liver enzymes. Also, it could cause liver failure as a side effect and adverse reactions. And then also nausea and vomiting. Contraindications for the acetaminophen includes history of hypersensitivity and liver disease. If you have any of those items, we definitely will not give you this medications. Do you have any questions about your meds? None at all? Okay. Are you okay with taking your meds in 1 cup? Okay, good. So I'll go ahead and prep your tablets first, and then we'll go to your liquid medication. All right. So let me get hand sanitizer. Clean my hands first. All righty. Okay. Now that my hands are clean, now I'm going to do my final medication check. So I'm going to check the patient's medications against the MAR one last time. Like I said, I'll be checking it 3 times. So before I administer this medication, the 3rd time is just my last safety net, just to make sure we're giving them the right medication to the right patient, the right dosage, the right time, the right route, and the right documentation, right? Everything looks good on the 6 rights. So let me go ahead and start with, as I said, the tablets. Put that one there. Good. Good. And one more. Okay, Mr. Jones, are you okay with drinking water with your pills? Yes? Okay. So patient is in an upright position. Patient's comfortable in an upright position. And I'm going to go ahead and give the 4 tablets. Well, let me take the water top off. Okay, here's the 4 tablets. Here you go. Patient, take that one. Here's the water. Good. Good. You got 1 more tablet. And there you go. Okay, and water. Good. All done. And you did all the pills. So here's a little more water. Okay. All right. And now with the liquid medication, it's very important that we do this a certain way. We want to shake the bottle first. We want to turn the labels towards your palm. You want to protect that label. And because when you pour it, you want to make sure that it doesn't go, there's a chance that it may run into the actual label. So we want to protect that label. We want to get it eye level, right? We want to take the top off and make sure we put it facing up. Top is up. We want to get it eye level, and we want to pour 15 mLs, 15 mLs, 15 right there, mLs, right? We want to make sure with the paper towel, we want to wipe around the edge of the bottle, making sure if there's any drip, we want to get that up. Put the top on. Let me show the camera real quick, the 15 mLs. 15 mLs. Okay. We're going to have the patient take the medication. There you go. Good. Mr. Jones took the medication. Would you like to sit in this position for a while, Mr. Jones? Okay. Patient, here's your call light. I'll go ahead and clean up the area. I'll do hand hygiene. And I will go and document my skill. Thank you very much.